Good evening, everyone. Welcome to our first edition of Talk Your Heart Out online version, where Talk Your Heart Out is an initiative by Onco.com. And in Talk Your Heart Out, we ask everyone whose life has been touched with somebody who has been affected with cancer or who has been a supporter or caregiver to cancer patient. So that's the entire initiative's idea. So I welcome you all to Talk Your Heart Out. It's initiative by Onco.com. Onco.com is a online portal which helps you to connect patients to the nearest caregiver, doctor, hospital, anybody whom you require for your cancer journey. It provides you support in 360 degree. So welcome. Today we have our guest Jason D'Souza. Jason, please say hi.
Hey everyone, how's it going?
We have 25 participants with us joined in, apart from you and me. Yes, that's a great number.
Yeah, I know.
Jason here is a two-time cancer survivor, and he's here to share our cancer journey. So I'll be asking Jason some questions. Jason, are you ready?
Yeah, shoot.
So let us start with something very casual. How was your journey?
There's no easy way of saying it. I mean, it was tough, really tough. A lot of people, were there with me. My parents, my cousins and all, they supported me a lot. And without them, I don't think I'd be here today. And not only them, not only my family and close friends, even the people who have donated blood and platelets for me, they have been instrumental. And last but not least, the doctors and the nurses, all of them were so good to me. And I don't think I'd be here, sitting here on this call because of them. Without them, I mean, sorry.
Mm-hmm.
Yeah.
Okay. So connecting to your and my present condition right now, given the pandemic which is going global, are you able to go to your routine checkups to your doctor? I mean, what is happening with coronavirus lockdown which is going on?
Well, as you know, the lockdown is nationwide, so no one can leave their houses, and it's restricted. I guess till April 30th. It might get extended after that also, I don't know. But the thing is, I have not been going for checkups. I mean, it's not compulsory for me to go for checkups anymore. My doctor felt that it's not necessary for me to visit him anymore because I'm fine, by the way. So there's no need for me to visit him. He had recommended doing PET scans because I'm a survivor of Hodgkin's lymphoma as well. But I didn't feel it was a feasible thing to do. He wanted to do it for 5 years. That's the only thing he recommended. Other than that, he was happy with the progress I've shown.
Mm-hmm.
So that's it.
Great. How do you spend your time during lockdown? I mean, everybody might be wondering.
Honestly, work from home and Netflix and chill.
Most of us might be doing that. So I'm sure everybody will be having a smile at their faces.
Yeah.
So if anybody wants to share some message during Jason is speaking, please put a message on the chat so that we get the questions rolling and we will know what are the questions that you are asking Jason, and I will redirect it to Jason while Jason is talking. So let me touch a very sensitive topic here. I mean, when you got to know that you had cancer, it would have not been easy. And we all know that cancer treatment causes a lot of discomfort in you. And it's not just discomfort within, but externally how your body looks also change, right? So did you have any body image issues? Just a second.
Yeah.
Okay. Yeah, please tell.
So yeah, to answer your question, yeah, there were some problems with my body image after chemotherapy. You know, I lost my hair, and along with this chemotherapy, I had to undergo radiation during my second diagnosis and my second round of treatment. So in addition to losing my hair, my skin also turned black. It turned dark, and my skin started peeling off. So at that time, I was looking at myself in the mirror and thinking, you know, I don't think that I'll ever come out of this, you know, and ever, look my normal self again. So those were the thoughts that were going on my mind. But eventually, it worked out. I mean, everything's fine, as you can see. Uh, but at that time, it was very difficult to believe it. I could barely recognize myself in the mirror, and my mom also couldn't recognize me. Like I was in the bone marrow transplant unit, and she walked in, and for a minute, she thought that she was in the wrong room because she couldn't recognize me. She went out and she came back again because yeah, that's how it was.
Okay. I'm sure people who are listening in find it really motivating on how did you cope with it. I mean, it takes immense amount of courage, and it's really amazing how you're sharing your story. It shows, like, you know, what all you have gone through, and it is truly inspiring. So, uh, I have a question which has come in right now.
Okay.
Uh, it is by a mutual friend. He asks, how do you keep motivation levels up when you can't move around?
Yeah, that is a tough one. You know, I guess everyone will face this at some point uh, of time when their treatment is going on. Well, personally, when I was experiencing this, I was mostly lying in bed and sleeping it off. So I don't
Mm-hmm.
remember a lot of that. But I guess the key is to, if you don't feel like doing anything, the least you can do is talk to your family, like if they are with you, or your friends, or someone whoever is there with you. You know, keep your spirits up by talking to them. That's the only way I
Mm,
can cope. And you know, what it's something that I did.
okay.
Yeah.
Okay. So, one more question has come in. She asks, where did you have cancer exactly both the times? So, if you could explain your first cancer cycle and your second cancer cycle.
Yeah, I'll do that. So the first time round, I was diagnosed with acute myeloid leukemia. In other words, blood cancer, and I was abroad at that time. So I came to Bombay for treatment. I was admitted in Leelavati Hospital for 4 cycles of chemotherapy. The first
Okay.
cycle was intense 7-day chemotherapy. After that,
Mm-hmm.
there were 3 more doses of maintenance chemotherapy. So
Okay.
okay, that was in October 2014. I was diagnosed, and the treatment went on till March 2015. That's when the doctor was happy with the results, and he told me I'm in remission. After that,
Mm-hmm.
I decided to pursue my higher studies in the US. So I got into a university in Texas, and
Mm-hmm.
I took over there. I was there for a period of 2 weeks. And just before I was supposed to start my classes, I just went in for a random blood test to the local hospital.
Okay.
And the blood test, it was found that my cancer had relapsed. Okay, at that time, everyone was thinking it is just AML, acute leukemia. So we went, I went back to India, and this time I definitely needed a bone marrow transplant. So
Okay.
Bombay was a little, to be honest, it was there were a lot of people waiting in line for a bone marrow transplant. So
Okay.
Bombay was not an option. So my parents and I mutually decided that it's best to go to Pune. This
Okay.
One of the reasons why we decided is because I had a friend. Her name was Shreya, and she had the same diagnosis as me. And she also had a relapse, and she also needed a bone marrow transplant, which meant that she had to go to Pune, Dinanath Venkateshwar Hospital, Pune. That's where I went on her recommendation.
Okay.
And, during my stay over there, it was from January to March. Uh, there was a swelling in my neck. This a lymph node in my neck was swollen.
Hmm.
So doctors couldn't figure out what it was, and they were wondering why the chemotherapy is not working as well as it should have. So they did a biopsy. I don't know if you can see the scar over here. This is where they did the surgery, and they took out a small piece of the lymph node. And when they ran a biopsy on it, it was found that I also had a second cancer, which is called Hodgkin's lymphoma. Now the strange thing about this is there is absolutely very less chance of someone having acute myeloid leukemia and Hodgkin's lymphoma together. It's having it the other way around, meaning Hodgkin's lymphoma first and AML. That's normal. That happens sometimes. But this, what I had, was very rare. So the doctor was in a dilemma. He didn't know what to do and what treatment plan to pursue for me. Eventually, after consulting most of his colleagues from all over India, he decided to send me for radiation. And immediately after that, when he noticed that the radiation also was not working, he decided to do a bone marrow transplant. And my sister was chosen as the donor. So there was a 60% match between me and my sister. So we went ahead with the transplant, and thankfully it worked.
Okay. There is one more question which has come in. How is your perspective towards doctors from day one to the time that doctors said that you are in remission? Like the day one doctors ask you, right? Or say that you have been diagnosed with cancer, and then you undergo the entire treatment cycle, and then you are in remission. So how is your perspective towards doctor changed from day one till now?
Well, in my case, my doctor was a very kind man. He was very honest, and he was upfront with me. He told me, this is what is happening, this is what we are going to do, and you need to be brave. And he was a very fun-loving guy, actually, to be honest. He used to crack jokes all the time. He even had a nickname for me. He used to call me Jace the Ace. I don't know.
What did that mean?
An ace of hearts or something. An ace generally.
Okay.
There's a story behind that, actually. So during my first round of treatment, when I was in Bombay, I unfortunately developed septicemia because of some hospital infection. And I was in the ICU for 3 days, and the doctors had almost given up hope when one of the drugs they administered started working. And so since then, he started calling me that nickname. I didn't really like it, but okay, let him have it. But so he believed that I really fought, and I won. So that's why I guess he must have thought that name was suitable for me. Yeah.
Great to know that.
And so my perception of doctors, coming back to that topic, both my doctors actually, the one who was in Bombay and the one who treated me in Pune, though their personalities are slightly different, they were both very good people. They did their best to make sure that I was free from cancer, and they exhausted all avenues, you can say. So I'm really grateful to them for that.
So the person who asked the question is telling that your reply has been brilliant and absolutely positive, and he was really expecting a reply like this to go out to all the people who are watching this live, or after this also, if we post this video online, people will know what you have shared about doctors. And at this time of the hour where pandemic is going on, I mean, they are a true force who are on this day and night trying to fight this. And your reply will definitely boost them up, motivate them, encourage them to keep going at the divine profession that they have chosen. So amazing, Jason. So far going so well. And in the meantime, there is another question. The question is asked by my aunt, and the question is, how were your parents through treatment both the times? Maybe a parent's perspective is required here for the listeners. So if you could share.
Both my parents were naturally devastated because
Okay.
never in their wildest dreams they thought that I could end up with something like this. They had only heard about it from other people or read about it from somewhere, but they never thought that their own son would get diagnosed with such a dangerous disease. My mom,
Okay.
especially, she just couldn't handle it. She all she did was sit in the corner and just pray. I mean, at that time,
Mm-hmm.
I totally understand because she didn't know what to do. My dad, on the other hand, though he was equally devastated, he never let us see it, to be honest. He was like strong and firm. So,
Mm.
dads, that's how they are. Uh, and my dad, he was there next to me every time they used to poke me with the IV needle, right? The thing
Yeah.
is, my first round of treatment, uh, all my chemo was taken with the help of IVs only. So by the time they were done with me, my hands were swollen, my
Mm.
arms were swollen, and they
Yeah.
couldn't find chemo veins. That was because of the chemotherapy. So naturally, he was there with me and he was helping me get through it. Yeah. So my parents were a big support. So that was the first time round. The second time, okay, after I was in remission, they were very
Mm-hmm.
relieved. But when it came back again, they were a little better than the first time. They were a little
Mm.
more stronger because they had handled it before. They knew basically what would happen and what to do. Not like the first time where they were completely lost and
Mm.
didn't know how to deal with it.
Mm.
That's about my parents.
Great. Great. I mean, could you share their names here for everybody so that they can put a name to
My dad's name,
uh,
yeah, okay. My dad's name is Oswald and my mom's name is Joyce.
Oswald and Joyce?
Yeah.
Beautiful. Beautiful. Uh, okay. To back up your this question, there is another question from the audience. Who's a very good friend. He asks, "What helps you to stay so positive?"
Well, to be honest, I try to maintain a normal routine most of the time. So you
Mm-hmm.
see, the thing is, I'm really fond of gaming,
Okay.
and at that time I had just graduated from college. So me and my
Mm.
friends were texting a lot, and we were cracking jokes and sharing memes. So basically,
Mm.
memes, video games saved my life. I can say that. Uh,
Okay.
and yeah, so and my cousins and my aunts, they were all very fun people to be around. They never let me feel that I was going through such a bad phase. They were always there
Mm.
for me, cracking jokes and making me laugh. And even when I was taking the platelets and the chemotherapy and all that with the side effects, and they were
Mm.
still reassuring me. So I'll have to thank them first. And coming back to your question, the key is to maintain a normal routine. Take your mind off these things that you're having.
Mm.
Don't think about what is going to happen or what could have happened. That's not the right way to deal with it. Motiv-
Mm-hmm.
just there's no need to motivate yourself. Just follow a normal routine. Do what you like doing, and
Mm.
that's all I
Mm.
can offer. I'm just telling you what I did.
Great. There was another question. I think you answered it during this question itself, saying, while you are undergoing the treatment, how did you motivate yourself for positivity? I think memes and video games again were
Yeah.
your lifesaver, and friends. Yeah,
Yeah.
great, great. Uh, there is a question from your dear friend, and it's a trivial question, but nonetheless, I will ask for the sake of it. How's Corona different from cancer? It's a medical question we can't answer, but still, on your opinion.
Well, I'd rather take cancer over corona, if I should be honest,
Oh,
because
why?
this virus is, though it seems like a flu, I don't feel it is that easy to handle. I mean, just look at the state that it has put us in.
Mm,
Lockdown everywhere, doctors and nurses being overworked, not able to see their families, people dying in large numbers. it's a really bad situation. And I can tell you how the virus is different, based on the symptoms and what how the cancer is different. But I think I'll stick to this way, what I'm talking about. So I'm not saying that cancer is a small thing. It's not. It's It's as dangerous, but like cancer will never cause the whole country to shut down like this. That much I can tell you. I mean that's obvious, but I'm just bringing it to the light.
Okay. I'm going to ask you one last question, then we will open the forum for face-to-face questions. If they want to say something to you, say thank you, or ask you any question on video where you can look at them and answer them directly, the forum will be open. But before that, a last question from one of the participants, which I feel is very relevant at the time of corona pandemic and the disease that we are all going through, is what is the role of fear and how do you deal with it?
Well, that's a tough one.
Yeah.
That's a tough one. Yeah. The thing with fear is it's very unpredictable. It sneaks up on you when you least expect it. I think one moment you're fine and the next moment you're suddenly freaking out, thinking what's going to happen and how are you going to manage with it. So the best thing you can do is you just have to believe that you'll be okay. I mean, that's all I can say. I mean, everyone gets afraid, everyone's scared because it's cancer. It's a dangerous disease, and there's a lot of problems and complications involved with it. But at the end of the day, it's your way of telling yourself that it's going to be fine. I'm going to get out of this. That's the only way you can handle the fear. You should keep telling yourself that one day I'm going to get better and do all the things that I've wanted to do. You keep telling yourself that, and fear won't matter. You will be out of it. Maintain a positive attitude. That's all I can say.
Wow, I'm just feeling immense sense of gratitude, and thank you for joining us in Talk Your Heart Out. And now I will open the floor for questioning. People can unmute their mics, show your video if you want to say something, or if you want to tell something to Jason. Please feel free to do so. Alden has unmuted. Yeah, Alden, please say something.
Hey Harish, hey Jason, good afternoon.
Good for you, man.
Good. So Jason, nice sharing. I think there were a few things that you haven't touched upon in the earlier sessions, which you mentioned. So there was one question that I sent to Harish, but he didn't ask for whatever reason. Just thought I'll mention that. So just wanted to know from an emotional standpoint, when we heard that Dhanusha had passed away, the girl with cancer in St. John's. So, what was running through your mind? Because I know that you strongly believe that she'll get through it, but then eventually we knew that it's not going to happen. And then, what did you feel like? Did you feel like it was a loss at a personal level, or what were the emotions that you felt?
It's it wasn't easy. I was very upset. Naturally, I mean, her family, just to give you a little background, her family had exhausted all options, and they were just asking for donations. And in fact, they received the donations, and that's when I started to hope a little that she'll be fine. The girl is going to be okay, and she's going to survive this. But when it didn't work out, I was very, very, very devastated. I just didn't know what to do. And I remember telling you first. Then I slowly told the group as well. And I remember her because we had interacted with her on a clowning session, during a clowning session, I mean. And to see her laugh during that time, it made me happy. And then I realized that we won't see that again. It made me even more sad. So that's all. Yeah, I don't have any words besides this. It was very hard.
Yeah, same here.
How is that boy having that much of confidence while
Hello,
speaking?
No, you please directly address it to him.
There's no trace of fear.
Trace of fear, yes.
So your question was?
How
Can
did you get out of the fear of talking in front of everyone?
So,
Okay.
in summary, she wrote a message. In that message, she had asked the question.
Okay.
This boy shows no trace of fear. How did you get out of it? Is their question.
Out of what? Talking to people like this, or the cancer?
Cancer.
Cancer.
Okay.
Cancer.
Yeah. So I've answered this like previously. There's no remedy for fear. Everyone is afraid. Everyone gets scared. You just need to tell yourself that it'll be fine and look forward to your life.
That is done.
That you have more to do. You have a lot more to do before you go. So when you think about that, you'll have a desire to live. So that's what I did. I thought of all the things that is left for me to do, and that's what kept me going.
I really want you to just meet Anjali ji virtually, because Anjali ji, unmute the mic. Okay, wait. Please say.
Hi, Jason. I love you so much.
Thank you.
Hats off to you.
And I just want to say, I think you're a survivor, aren't you?
Yes.
Yes, that's what I wanted to hear.
Love your story.
Thank you, ma'am. And
I salute you. You are a great boy. My chocolate boy.
Thank you, ma'am.
Anjali ji, could you in very short tell your journey so that people know there is a survivor like you also amongst us? Could you please, in short?
Yeah, I'm a cancer survivor. 2015. And I complete all this thing in 2016. Chemo and all. Very happy journey. Good friends. Family. And now you can see, yesterday was 5th year cancer-free date, Mike.
Nice.
Whoa.
Now I'm a belly dancer, folk dancer, swimmer, diver. I have done 2 movies right now. Coronavirus ka. As a grandmother acted. Now I'm acting as a short movie. It is going for a festival, lockdown festival. So my shoot is going on in my house only.
That's
Enjoy my life, and I have a lot of friends. And I love you, Jason. You are my chocolate boy.
Okay, thank you.
Anjali ji, I think you forgot one very important thing in between, is that how you have won a beauty pageant. Please tell about that.
December 2019, I got the crown of Mrs. India Iron Lady. That is held in Delhi. And I took part for the cancer survivors and cancer people to show them there is a life after cancer. You can become a beauty pageant also. I have a long hair, don't worry. This is my fashion.
Oh, okay. Okay.
And I won the beauty contest and I spoke on the stage.
I think her video.
The color doesn't matter. And I'm a brave lady fighting for I just took this for the cancer people and cancer survivors. I was only the cancer survivors, 6 girls.
That's great.
And I got the crown.
Congratulations on that,
Thank you so much. And I love your story. Courage. Hats off to you.
Thank you so much. It's very nice to hear from a fellow survivor.
Thank you, beta. I'm a grandmother.
Okay.
58 years old, but mera heart jawan hai.
Definitely.
And after this, I got a lot of opportunity like acting in the movie, acting for play. I have a play every Saturday. So now it is lockdown.
Okay.
And I am a stage performer. I do folk dance. I'm a belly dancer, swimmer, diver, everything after cancer I started.
That's wonderful.
Like anything.
I should also start something now after.
You have to, yes. I want to tell you. Do all the activities, whatever you like. What is your passion? Do it.
Yes, ma'am. Definitely.
God has given us a second chance. So use it wisely.
Yes. Thank you, ma'am. Yeah.
Yes. You're always
Anjali ji,
Yes,
to छा गए.
I tell all of my
Amazing.
friends, enjoy your life, be positive, enjoy, Don't think क्या होगा मुझे क्या होगा. Nothing will happen. जो होएगा, face it. Lord had given the way to, every solution has a problem. Problem has a solution. Sorry.
Yeah.
So there's a way to go out,
Yeah.
And today, because of that, we are surviving.
Yes, ma'am.
और कैंसर तो छोटी चीज है. It's a small thing. मैं सोचती छोटी चीज है. Fight it.
Okay.
है ना? Yeah, beta. All the best. And do all the activities, whatever you like. That
Definitely.
was the one time था अपना निकल गया.
Yeah.
आगे बढ़ते जाओ,
Yes, ma'am.
Be positive and love your story.
Thank you, ma'am.
Hats off to you.
Thank you.
Thank you, Anjali ji, for joining us and inspiring all of us. I think my next Talk Your Heart Out or next to next, I'm planning to invite you as a special guest. And
Sure.
Aapne, whatever you said in such a brief thing, I want you to, shed more light on it because it will be very inspiring for all the others. And to those who are watching, stay tuned. Talk Your Heart Out is coming again, and Anjali ji is going to be a guest, special guest. Anjali ji, with that, I think next question has arrived. Could you just switch off the video?
Sure.
Thank you. Gautam.
Hello, happy evening, fellow clowns. Happy
Hey.
evening, Harish Bhai, and a very happy evening to our special guest, Jason. So I really congratulate you that you fought against such dreadful disease, which we've been seeing from past 5 years, I hope. And I've been associated with Compassionate Clowns for more than 4 years. So I've been seeing cancer very closely. And I had a few family members also who went through the same, and they unfortunately couldn't recover cancer. And so we lost them in the journey. But I'm really happy that you recovered. And I don't think so that I've met you in Compassionate Clowns or seen you anytime. So I lost touch in between because of work schedule and stuff. So when I read your name, it was mentioned as Jason. And in the first part, I think first 10 minutes, I missed out your journey and your story and stuff. But I just went out and I was just thinking, so do you know that the meaning of your name, Jason, in
Yeah.
Greek, it means healer.
Yeah, I know.
So
Wow.
how can something affect a person with such a positive vibe? So, and I also saw a lot of questions coming across relevant to fear, and people are asking you about fear, and you are a person who went into the jaws of death and came out, and so definitely you have seen something so closely, and definitely nothing can affect you. So fear is just within our minds, and we have to fight it. And sometimes we lose faith in ourselves in the journey, and we start believing that we will not be able to make it. So probably people like you motivate us. So probably I just had one suggestion, and I have no questions to ask you because I know you are a positive person. So anywhere you enter, definitely that environment will definitely become positive. So I just wanted to suggest something, is that I want you to be part of talk sessions, and we should have a circle with the patients wherein you, being a cancer survivor, giving them hope, that will probably boost a lot of positiveness in them. So I
Yes.
want you to be part of that.
I wanted to do that myself. But because you have to wait until this lockdown gets over.
Yeah,
Currently,
definitely.
so
Yeah,
once it's
definitely.
over, I'll
So-
come back to Bangalore and then we can think about it.
Sure. Nice
Yeah.
meeting you, Jason.
Nice meeting you too. Sure. Take care.
Sure, bye.
Thank you, Gautam, for suggesting that. I'm sure, Jason,
Yes.
I also want you to do real-time talk shows where you inspire a lot of people to come out, share their journey. Yeah. Anybody else?
Hi.
Hey, Catherine.
Hey, how's it going?
Going good. How are
Hi.
you?
I'm good. It's 3:00 in Alaska. It's nice to meet everybody. Jason, I wanted to ask you, what made you find out you had cancer? Did you start feeling ill, and what was your journey to find out your diagnosis. What were your first symptoms of blood cancer?
Yeah. So after graduating from college, I was in Doha, Qatar for a little while, and I was figuring out my next move, whether to go for higher studies or maybe get a job. And while I was doing that, I had a hobby, which was swimming. I used to go swimming every now and then. So this one particular day when I went swimming, I was doing a few laps, and all of a sudden, I started feeling very sick. I just got out of the pool and I went to the locker room. I took a very hot shower, and after coming out of the shower room, I couldn't stand. I thought I was going to collapse. So I just found the nearest bench, and I lay on it. So I was lying down for 15 minutes before I started feeling better. And then I went home and I told my mom and dad what had happened, and they told me probably it's some kind of viral fever. We'll get you tested tomorrow. And so me and my dad, we headed down to the clinic, and we did a blood test. And in the blood test, everything was normal. So the doctor asked me to do a second blood test, and she told us to go home. The next day when my dad is at work, he gets around 20 missed calls from the doctor. And when he calls her up, she tells him that you need to come in immediately and bring your son, because it's really important that you do. So we went back to the doctor, and she took my dad to her office and told me to wait outside. And after some time, my dad comes out, and he doesn't say anything. He just sits down next to me, and he has his face in his hand, like this. And I asked him, what's going on? Why aren't you telling me what's wrong? And the next thing I remember is that there was this pathologist in the same clinic. He called me to his office and started asking me weird questions. He started asking me things like, are you eating properly? How is your sleep? And are you having any pain in your body? So at that time, it struck my mind, something's not right. Why are they asking me all these strange questions? And when I was outside with my dad, I told him, I basically asked him, if there's anything wrong with me, you better tell me now, because if I find out later, I'm going to be very angry. But still, he wouldn't tell me. He just made up some excuse. I think he said, it's nothing. There's something wrong with your blood. We need to take you to the doctor. And at that point, I was already planning to travel to the US to study. I hadn't started applying yet, but that was definitely on the cards. But he was like, no, we cannot do that right now. You have to go to India the very next day and start. I'm like, what is going on? We arrive home, and my dad just takes my mom to the corner, and he tells her, and my mom starts crying immediately. That's when I knew that something is really, really wrong. And I just went and I told my parents, why are you behaving like this? You're acting as if I have cancer. And they just looked at each other like this, and they didn't know what to say to me. Okay. And my dad kept telling me, there is something wrong with your blood. We need to take you to India, and we need to admit you in the hospital immediately. And we got to India the very next day by an early morning flight. And the very same day, we went to the doctor. And when the doctor was done we did a bone marrow biopsy. Basically, they take the marrow out of your back, and they take it for a biopsy. He did the biopsy, and he just gave me a prescription sheet, and he wrote on it, start administering chemotherapy immediately. That's when I realized that it could be cancer. And that's when I kind of knew. But I still was optimistic. I still was thinking, no, maybe he's wrong. Maybe the report could be wrong, and I could be fine, and I could go back to Doha and start applying for colleges again. But after a few weeks, I got the biopsy report, and it was positive for acute myeloid leukemia. And that's when I realized then I had to put all my plans on hold and just deal with this. Yeah.
Wow. I can imagine how scary that is, and I know as a young person, that's just the last.
I was 22.
Wow.
Yeah.
Well, I just want to say that your strength is amazing, and you're just talking about your journey is so relatable, and I believe you're going to help so many people. And the time I've met you, even just through the internet, you've helped so much. And your story is amazing. Your strength is amazing.
Thank you a lot, coming from a fellow survivor, and
Yes.
You are very brave and you're an amazing person. And I'm really glad I met you.
Yeah, me too. Thank you so much.
So, meanwhile, everybody is listening in. Catherine is a stage 3 non-Hodgkin's lymphoma survivor, and we connected. She's from Alaska, and she is a very, very positive person as well. So, in the coming weeks, Talk Your Heart Out episode 3, 4, so 2, 3, 4, and all, we have real time survivors who is going to come in and talk about their journey. And Catherine here is one such person. I already took her permission. And the moment I said, will you be willing to do a Talk Your Heart Out with us? She did not even think for 5 seconds. She's like, why not? I would love to do something like that. So, Catherine is an amazing human being. Thank you so much for joining us.
Thank you. This has been amazing. Thank you so much.
Thank you. Thank you, really. Catherine, could you put on the screen? Yeah. I think we have the next question. They have already raised their hands. Their name is showing as Real Me 3I. Can you please ask your question?
Hello.
Hey Darren, what's up, man?
Hi, Jason. Yeah, man, it was like great. Yeah, you are motivating many people. Yeah, that's great. Even in the clowning, you motivate people, and even in this talk, also, you are motivating many people.
Never do be as motivating as you are, my brother.
Yeah, man. Great to see you all. First of all, like we are missing already. We are missing clowning sessions and all.
Man, I know.
Yeah, great to see you all, guys. And we had a little chat also last 2-3 days. Me, myself, Harish, and Mari and all to do a clowning online with the help of the Zoom app and all.
Yeah.
So we're also working on that, and let's see. It's all Harish's idea, and we have to like one more thing. One more thing is there. The kid which we lost, no, what's her name? Danusha. That girl, like, yeah, that one I missed her, seriously. Like, I could for that session, I was not there, and then Mari called me and said, like, no, she's like very sick, and you have to go and see her. Like, before that, I couldn't see her. And what else to tell you? The entire session, this Talking Out is helping most of the people, I think.
Yeah, it is. It definitely.
We think a lot on getting depressed on many things, which are like very silly things. But you guys are faced the end of the life. You're gone there, and you've come back, and you are giving a message to many people, and that's like very motivating thing. And keep up the good work. And as Gautam said, you should talk on TEDx also, yeah.
Oh, well,
A group of people, you should talk on TEDx also. It will be motivating for many, I think.
I don't think I can ever come up with that. Might sound very far-fetched. Yeah.
Great.
So you have questions for me?
Yeah, no, nothing, no questions. Like, I'm just waiting for the lockdown get down.
Great. So thank you, Terran. Yes. If you could switch off the video. I think Mugil is already waiting.
Hi, Jason. Hope all are doing well, Anna.
Yeah, hello? Mugil, all is well.
What's up, man?
Hi, Anna. Hi, Jason ji. Happy seeing you all again. Taran Anna, Gautam ji, everyone.
You too, brother.
Hello. Anji. And Jason, but really, it was really inspiring, bro. The one sentence which you said that at 20 you got collapsed and now you grow stronger. You have grown stronger than before, and you're like making everyone get stronger. All the patients out there, you're making them feel stronger like you. so inspiring. Really, really feel inspired and surprised by seeing all. And what I wanna ask is like, can we indulge them in physical activities, like patient who is undergoing these therapies, physical activities, or we can support them only mentally
Well, it depends on how they're feeling.
to make them watch something or activities?
It depends on how
Mm.
they're feeling, because the thing is with chemotherapy.
Jason, can you come to the center of the camera? So you're going out while you're answering. Yeah, perfect. Yeah.
Yeah. So what I was saying is, it depends on the patient. You cannot force them to do anything that they really want. Because the thing, chemotherapy is, there are some days when you have so much energy and you feel like dancing, you feel like jumping. But on the other days, when the chemotherapy is taking its effect, you can barely get out of bed. You feel sick all the time. You don't feel like eating. You feel like throwing up all the time. So it all depends on how the patient is feeling. So if you're going in a cancer patient, you got to judge the situation, and you need to understand how the patient might be feeling, and based on that only you need to take an action.
Mm. Yeah, Jason, thank you. I'm happy that we have all. Uh, I'm okay, Jason. We are happy that we have you, so that you can guide us every time whenever we are in clowning. So if we do something which affects them, you will be there to guide us. Thank you, Jason.
My
I
pleasure.
hope the situation fades soon and we will start our clowning back.
Yes.
We'll have our old days again.
Yeah.
Fingers crossed. Thank you, Mugil. I would like to ask.
Bye, Anna.
Bye, Mugil. I would like to ask Dr. Jennifer.
Hello.
Yes.
Hi, Harish. Hi, everyone.
Hi, Dr. Jennifer.
I guess there's some issue again.
Yeah, there is some issue, I guess.
But we can hear you. So if you want to say something or ask something, please do.
Actually, after hearing such positive, things from everybody, I'm actually feeling very good, because I'm a care manager. But since I have suffered a lot in my family, so my mother, she was not diagnosed with cancer, but she's actually in coma from last 2 years. So it's been a very tough journey for me, but from like, I am actually a very positive person. So what I feel is, like, if someone is into some kind of trauma or something like that, person should enjoy their life. Whatever things are coming on their way, the one thing a person can do is, just enjoy your life with the family. That's all. You should not think, in a bad manner, because everything makes you better, I guess. So I actually have I've been through a lot of people, because being in a counseling aura, every time I have heard a lot of people coming to me and talking about their life. So I know it's extremely a very I couldn't explain, because after hearing a lot of these things from all of you, I'm actually quite emotional right now, because I know what happens next. So I am actually very grateful to all of you. And Jason, I actually salute you. And for everyone, that they should they should actually motivate themselves, because no one is here to motivate anyone. Apart, you have to motivate yourself, going ahead in your life. That's my rule of going ahead in my life. I motivate myself. So I guess it's very important to get motivated by yourself. That's what I want to speak, because I'm actually very touched right now. And I'm blessed that I am actually, I'm talking to so many people. I'm listening to so many people who are actually warriors, real warriors. So thank you so much. Thank you, Harish.
And Jennifer, thank you so much for sharing your experience with us. I just want to say that I'm going to keep your mom in my prayers, and I hope she recovers completely.
Yeah.
Yeah, so I just want to say that.
Thank you so much. Thank you so much.
Thank you, Dr. Jennifer, for saying such amazing, kind words. I mean,
Yeah.
it is a privilege that you are here. Thank you.
Thank you, Harish. God bless everyone over here.
Nice. Thank you so much. Jason, you're not supposed to switch off your camera.
There was an issue, internet.
Okay, good. I think we have one last video suggestion. And Krishna, do you want to say something? I think in between you wanted to say something. Yeah, please.
Yeah. Hi, Jason. How are you doing?
Krishna, how are you?
I'm fine. So, a lot of things told here today, and really happy that there's a TYHO session going on, Talk Your Heart Out session going on. Inspired by you, Jason, Anjali, Catherine, everyone who has said everything. I just wanted one thing, Jason, if you could, say it again. It's Talk Your Heart Out, so you're going to say it from your heart. So, my dad passed away last year because of lung cancer. We did our best to help him fight, but it didn't work out as planned. So it was a very steep fall in a couple of months. My uncle's undergoing treatment right now for prostate cancer. Another uncle of mine is a survivor. So there are a lot of things that happen in that respective man. I just want you to give a powerful message for all the mums and dads around the world right now, because as you said, I never had TYHO or Harish or Onko or any of the the clowning people in this group when I was undergoing that battle. So my request is to just for you to give a really powerful message to all the mums and dads of the world who are actually in between the struggle, either for their kids or either for their loved ones or whoever it is, so that they know that it's very possible to get out of this, and there are miracles that are there real time, as you, Anjali, Catherine, everyone, whoever spoke. So that's just one request to you that I have.
Okay. Not much I can say, but that will make them feel better because their kids are undergoing cancer. But I just want to say that parents, you need to stand by your kid or by a child always. No matter it's good, it's difficult. I know. I mean, I'm not a parent. I don't know what I can only tell you what my parents went to, but I can't experience it for myself. I've not experienced it for myself. But you need to be brave for your kids' sake, and be with them through all the nausea and the vomiting, and just pray and just know that your child will be safe. I mean, will be okay one day. And if I can do it, then definitely others can also do it by recovering. So you need to not give up hope.
Sounds good. Thanks a lot, Jason. And you're amazing, man. You're amazingly, amazingly amazing.
That's like very nice compliment to you, Jason. Like amazingly, amazingly amazing.
Yeah, I know that was not very motivational, but that I don't have a lot to.
But you stated the fact. I mean, that's what your parents did, and you would want all the other parents to do what your parents did, because it was an immense support for you. So I think it really, really makes sense what you just shared with everybody who is here. In the meantime, I request everybody to switch on their video now. I'm going to ask everybody to start their video. Please start your video, and keep your mic mute, unmute, however you want to. Everyone. I think we will prefer mics on mute. Everybody, switch on your, oh my God, and just do this. If you could just do this. Yeah. I'm waiting for Vijay Iyer, Priya K, uh, Vijaya Iyer, yeah, Lalantika, Krishnan Nellaya, Ratnaji, Priyaji, everybody to do this, a heart, and I'm going to click a photo, a heart next to your chest, a heart next to your chest. Dr. Jennifer Rizvi is here. Great, great.
A proper light, sorry.
No problem, no problem. There are 10 more people who haven't switched on their video. Please switch on your video. I'm waiting for them also. Then we could take a proper photo because everybody coming online and doing the heart is going to be amazing. Yes. Just do this. Just do this. A heart. Jason, can you also do?
Yeah, kind of hard to do it with one hand.
Keep the phone down somewhere and just look into the phone like this. Maybe. Perfect. A heart.
Okay.
This. Join it next to your chest. Yes. Perfect. Can I click a photo? Please smile, everyone. Perfect. Thank you, everyone. Please switch on your mics. Say hi, bye. Thank you, Jason.